welcome to the Dr. Tim Jennings Show, where we seek real answers to life's problems. I'm Dr. Tim Jennings, here with Susan Collenberg.
Good afternoon, everybody. Welcome to the program, and our topic today is going to be about depression and drug-free treatments. First, we have a question from our listener. Colin is asking, are people who have mental problems, such as sociopath or psychopathic, accountable for their actions, and what advice do you have for family members of those people?
So the first thing you have to do before you answer a question like that is say, okay, you say accountable to their actions.
Yes.
I assume they're not talking about accountable to society.
Okay.
Because that's an obvious one. A sociopath, serial killer, well, society holds them accountable, right? They are accountable to society.
Right.
So I don't think they're actually talking about accountable to society. I think they're talking about accountable to God.
Okay. Yes.
Okay?
Yes.
And so when you look at the question, are they accountable to God, then it really depends on what law lens you're looking through, how you answer the question.
Okay.
And people tend to want to look through the law lens of human law, system of rules, and then they want to, and if you break the rules, then there's a system of consequences, and then they go, but what about the sociopath? Because there's some brain science that the sociopath has some different brain processes going on and maybe don't have the same sense of conviction of wrongdoing, and therefore if they don't get the same conviction of wrongdoing or capacities for empathy, then can they really be held accountable for the wrongdoing that they're doing? Okay?
Right.
This is kind of what they're thinking, right? Or does God just wink at that type of thing?
Yes.
Okay, and then what do you say for families? Okay, that's because it's all those answers are all predicated through a false lens of reality. God's laws are design laws upon which reality are built, like the law of gravity. Every one of God's design laws are inherently healthy for you when you harmonize with them and inherently harmful to you when you break them. And so you say, what about the sociopath who jumps off the Empire State Building? Will God just wink at that? What about the sociopath or the psychopath who stabs a pencil in their own eye? Will they still have good vision?
Right.
What about the sociopath who smokes 2 packs a day? Will they keep good health? You see, it doesn't matter whether you're a sociopath or psychopath if you deviate from God's design laws. Now, I give physical examples, right? Mm-hmm. So what happens to a sociopath who is a chronic criminal who seeks to cheat people, maybe one of those sociopaths who is committing fraud upon the elderly in our society that have dementia and other things and stealing their estates and their retirements and savings from them. What happens to that person? Well, that person hardens their heart, sears their conscience, warps their character. They become more corrupt. They're more fear-ridden. You cannot avoid the corrosion of their inmost self when you participate in those things, whether you're a sociopath or non-sociopath.
Right.
And you don't, and understanding those realities, you can make intelligent choices and say, you know what, I still find that is wrong to do, even if I don't necessarily feel guilt for it. It's like when you think about the concerns about jumping off the Empire State Building, there are certain people who are genetically not afraid of heights. They have no fear of heights at all. And some of those all ended up working back in the Empire, when the Empire State Building was constructed, they were iron workers. And if you look at the old video of the Empire State Building being constructed, they didn't have any safety nets and stuff. People would walk on these I-beams that are 12 inches wide, thousands of feet in the air, and they were beaten while they're moving on these cranes, and these guys are walking on them. Wow. And jumping from one to the other, thousands of feet in the air, okay,
right.
Because they had no genetic fear of gravity.
Okay.
Where those rest of us have this terrible fear of gravity, so they're wired differently. Because they have no fear of gravity mean that they just jump off buildings?
No.
No.
Right.
Just because you may not have a conviction or concern about doing wrong doesn't mean you're destined to do wrong. You still have to make those choices, and when you make those choices, they're injurious to you. So then what do you do for families? What do families do?
Right.
Families need to recognize, if you're dealing with someone like that you have to set healthy boundaries. And those boundaries are based on objective reality, not the proclamations, protestations, promises of the sociopath. No, the boundaries are maintained, and those promises mean nothing.
Right. So it's all about being the healthy you.
Yes, right.
Okay, very good. So on to our topic for today, which is depression and drug-free treatments. What is depression?
So depression is actually a brain-body disease in which you have alterations in brain circuitry patterns of firing. Your brain circuits are not firing in the same balance. Alterations in the immune response of your body and inflammatory response of your body, and alterations in the subcellular, inside the neurons, functioning and genetic expression within the brain. So you have multiple things going on that alters basically brain function and health.
Are some people more prone to depression? then?
Yes. What makes people vulnerable to depression is a combination of their genetics and their environment working together. Some people are more genetically vulnerable. Some years back, they identified a particular gene that codes for the reuptake pump for a neurotransmitter called serotonin. And so when one neuron wants to talk to another neuron, it releases chemical in a little space called a synapse. The neuron that releases the chemical has little vacuum cleaners called reuptake pumps that will suck that back in after the signal and release for the next signal. Many of the antidepressant medications target those reuptake pumps, like SSRI, serotonin reuptake inhibitors, things like Prozac and Paxil and Zoloft and Celexa, and they will shut those pumps down. That's how they work, okay?
Okay.
Well, they identified that in the human genome, there are 2 gene variants for the gene that codes for the pump on the serotonin transporter.
Okay.
A short-arm version and a long-arm version. And when they first identified it, they found that people with depression, there was more people with the short-arm version. And so they thought, oh, the short-arm version, if you have that, it codes for depression. But what they discovered, in fact, that the short-arm version does not code for depression. What it does code for, it codes for sensitivity to the environment. So if you have a short-arm version of that transporter and you're in an abusive environment as a childhood with lots of stress, anxiety, trauma, abuse, then you have higher rates of depression than people with the long-arm version.
Okay.
But if you have the short-arm version and you're in a nurturing, loving, safe childhood environment, you not only don't have more depression than the long-arm version, you have less depression than the long-arm version, and you end up mostly likely being a leader in society.
Oh, wow.
So the gene does not code for depression, it codes to sensitivity to how you react to the environment. And yes, and so it's a combination of genetics, and there's multiple different genes involved, and then the environment interacting together.
So the environment can push somebody into a depressive state?
So, yes, so pathways into depression. When somebody is depressed, neural circuits in the brain are not firing normally. The part where you reason and think and organize and plan and problem solve right behind your forehead, that part of your brain is underactive. The part of the brain kind of behind the bridge of your nose a little ways where you experience empathy and compassion and love, that's underactive. And so people have in depression have difficult time concentrating, focusing, problem solving. They feel disconnected from people. The part of the brain above the orbit of your eye, which gives you a conviction of wrongdoing in depression, is overactive. So people will feel a sense of guilt, a sense of inadequacy. The part of the brain we experience fear is overactive. So people fear this dread, this apprehension, this stress. And the part of the brain we experience reward and pleasure doesn't respond. So even when good things happen, you don't feel any joy. So these are how the circuits are out of balance when people are depressed. So anything that would move the circuits that direction would push people towards depression.
Okay.
Once the circuits are in that pattern of firing where you have up activity of your stress circuitry, that increases in your body inflammation in your body, activates the immune system, which kicks up inflammatory factors, and those inflammatory factors will react back upon the brain, causing further cellular changes where cells that keep your neurons healthy get turned off, and you begin losing volume in certain brain regions, and that's what's happening in depression.
Okay. So it sounds like stress and fear can cause chronic...
So one pathway is anything that causes stress, unremitting stress and or chronic fear, or activates the fear circuitry, which would be chronic unresolved guilt or chronic unresolved bitterness or resentment. Okay, all those things that upregulate the stress circuitry drive people or push people towards depression. Absolutely true. And
so like the death of a loved one, is that something that, or no?
Yes, the death of a loved one absolutely could if it's unresolved. Okay. So the death of a loved one is going to be a highly stressful time, but depending on what you do in the aftermath of the death of a loved one, do you resolve it and then bring your neural circuits back to balance? You calm the fear circuitry and you heal and you move past it? Or do you stay stuck in this repetitive, ruminating cycle of negative thinking and self-blame and it's my fault and I should have known and all this type of thinking? Then that can then drive the inflammatory cascade that can lead to the changes of depression.
What increases the inflammation? Because you talked a lot about inflammation causing depression.
So again, I wanted to see the link. So one pathway is anything that causes the neural circuits to be out of balance will activate your stress circuitry. That's your adrenaline rush circuitry, your alarm circuitry, fight or flight circuitry, okay? And when you do that, that activates your body's immune system because your immune system is to your body what the National Guard is to our nation. It's there to protect us from invasion. And if you're being threatened by, say, a bear on the trail, animal, your alarm system is going to fire.
Yes.
And if you get bitten by the bear, you're going to have these enemy invaders trying to invade. So your immune system kicks up to protect you from a potential invader when you fire your stress circuitry. Okay? When you're under chronic mental stress, however, you're kicking up your immune system, but there is no enemy invaders for your immune system to attack. So your immune system will attack its own body, these inflammatory factors, and you'll get insulin resistance. You'll get increasing rates of diabetes and heart disease and obesity. And this inflammation reacts back upon the brain, causing those changes in the brain that lead to depression. So one thing, again, anything that moves the brain to chronic activation of stress circuitry, including unhealthy God beliefs, unhealthy beliefs in a God that makes you fearful, live in fear of condemnation, fear of going to hell, fear of making sins, fear of judgment, chronic guilt because you're not good enough. This also drives people into depression. Okay. However, you can have healthy thought patterns, not have your circuits out of balance, but do things in your lifestyle that in your body directly cause inflammation. And if such as eating an unhealthy diet. Okay. Studies show that people who eat fast food and junk food, which is inflammatory food, have a 40% higher rate of depression than people who don't. Okay. So anything that increases inflammation in the body can drive depression as well. Okay. So these are the pathways that cause depression.
So it can be mental, it can be physiological, it can be environmental. There's a lot of different...
Sleep deprivation, because sleep deprivation increases inflammation. You don't get your anti-inflammatory hormones, you get your circadian rhythms out of whack. So sleep deprivation can increase inflammation. Chronic relationship problems increase inflammation because it causes the stress circuitries to fire.
Okay. So what impact does early childhood have on depression?
So early childhood really sets the tone for the platform, the baseline firing patterns of your brain. If you have a traumatic childhood, it will upregulate fear circuitry, so your fear circuitry is less capable of calming itself and you're more anxious and stressful throughout life. If you have a nurturing childhood, then you develop patterns where you feel safe and secure and you're less reactive to the world around you, you're less fearful of the world around you, and thus you have less stress pathways activating, less inflammatory cascades, and you're less vulnerable to depression.
Okay. Well, that's very helpful to find out all these different things about depression. And stick with us because we're going to come back and talk about some more things about depression.
And some drug-free treatments for depression.
Drug-free treatments. That's the most important thing. Yes.
Yeah, we're going to talk about that when we come back. How to intervene and keep yourself well.
Perfect.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. In our busy society, it's all too easy to grab meals at the nearest fast food restaurant. But if you're feeling tired, run down, exhausted, and depressed, consider changing what you eat. Recent research of almost 9,000 adults has documented that those who ate fast food, junk food such as hamburgers, hot dogs, pizza, croissants, donuts, and muffins, had a 40% higher rate of depression than those who did not. Any amount of junk food increased the rate of depression, but there was a linear dose-dependent curve, meaning the more junk food eaten, the higher the rate of depression. Junk food is highly inflammatory food, high in oxidative saturated fats and devoid of micronutrients. Brain-healthy foods include fruits, whole nuts, omega-3 fatty acids, fish oils, and green leafy vegetables. To be smart requires a healthy brain, so be smart, chunk the junk.
To learn more about mental health, visit comeandreason.com.
In The God-Shaped Brain, Dr. Jennings reveals how changing our view of God changes our brain. In this book, you will discover how beliefs rewire the brain, how different views of God can alter both physical and mental health, how childhood experiences alter brain structure, and actions you can take to experience healing of brain, body, and relationships here and now. The God-Shaped Brain is a genuine breakthrough in understanding the human condition. Get your copy today wherever books are sold.
Welcome back to the Dr. Tim Jennings Show, and we are talking about depression and most specifically about drug-free treatments. Dr. Jennings, let's pick up where we left off on depression.
Yes, and so your question.
My mom had, her husband died, and she went on antidepressants right away, and it's almost like she never got through the depression, that she never was able to reset her life. Does medication stop people from resolving issues?
So let's talk about medication and where it comes in.
Yeah.
All righty, because we're going to actually want to talk about drug-free treatments for depression, but we'll have to actually, with depression, the number one treatment in Western societies for depression are medications.
Right.
How effective are medications? Well, let's say we take 100 people, and we're going to cherry pick our population. We're going to, only people who we're going to evaluate are people who this is their very first episode of depression, or if they've ever had depression and got medicine treatment before, they always got well. If they had one time where they didn't get well, they can't be in our study.
Okay.
So we're cherry picking our population.
Okay.
Now we take 100 people with depression and we put them on an SSRI, say something like Celexa or citalopram. What percentage of those people do you think will get well from that antidepressant? Well, the data shows that in that cherry pick population, 27% will get well.
Whoa.
73% don't get well.
Wow.
Okay.
Okay.
And most people think that antidepressants
All
are
I
like
gotta do is
magic
take a pill.
bullets and I'm
Right.
going to get well. Well, they really don't work that way. And if you switch them to another medication, less than 27% will get well. And another medication, less will get well. And pretty soon, by the fourth medication, about 9% are getting well. And so overall, medications are probably going to get about 35%. About 1 in 3 people will get well on medication.
So let's move into the non-medication, the other drug-free.
Yeah. So
treatments.
the first thing to do when you look at major depression, one of the problems with the reason why we have, I think, such poor outcomes in America on depression is that one of the weaknesses of the DSM-5, and the DSM-5 is the Diagnostic Statistical Manual of Psychiatry, and it is the Bible of how we diagnose. And they have all these different diagnoses. They have all these criteria. If you meet these criteria, you get the diagnosis. And in a depression, you basically have to have 5 out of 7 criteria, like 2 weeks of a depressed mood with less disturbance of energy, disturbance of appetite, disturbance of sleep, suicidal thoughts, feelings of worthlessness. 5 out of 7 of these types of symptoms. And if you have those 5 7 symptoms, then you meet criteria for depression, and you diagnose major depression. Okay? The problem is you can meet that diagnosis and correctly diagnose it, so it's correct,
Right.
but you still don't know what's wrong with the person.
Okay.
And what do I mean by that? You don't know why they're depressed. You see, one person can be like your mother who's had a major life loss, and that was really what's troubling them and brought them in a trigger to bring them into depression. Another person might have hypothyroidism. Another person might have untreated sleep apnea. Another person might be in a relationship where they're being beaten by their spouse. Another person might have internal negative thoughts about how horrible they are and how they can never do anything right. Another person may have trauma issues from childhood they haven't worked through. Okay, they all may meet these criteria for depression, but you still don't know what's wrong with them until you actually, and so the first step in really treating depression is to accurately diagnose and understand not just the symptom list of depression, but what are the contributing factors in this person's life that brought them into this condition of depression.
Okay.
And once you identify those contributing factors, then you begin interventions to address all the factors in their life that are driving them to depression.
Okay.
Okay.
So what are some of those interventions that
So
a
you
doctor
have to
would
identify
offer?
the factors.
Okay.
And then you go with the intervention. So we've already given you some from our first part of our talk today. One is if we have thought patterns or belief systems or life experiences, anything that's driving us to live under chronic stress and chronic fear. And so you'd look for what are those types of things? Unhealthy belief systems, fear of God stuff. Chronic relationship problems, where you're under arguments or your individuality is being compromised or you're constantly fighting and hostile. Those types of things. You're looking for things that are keeping the psychology. So you look for a negative thought. How do you feel about yourself? Do you have internal dialogue that makes you to blame all the time? So you're trying to identify anything to keep the circuits out of balance.
Okay.
That are historic and patterns of behavior.
Unresolved childhood
In your
issues.
mother's case, we'd look for the great loss, and then not just the fact that she had the loss, but in the aftermath of the loss, what is she telling herself about it?
Right.
Well, how is she putting this into her mind?
Right.
What is she looping on it? It's my fault. I should have done this. If I would have done that,
Or
it
I
wouldn't have
can't live
happened.
without him.
Or I can't live without him. Right. Are we making? And so these patterns of thinking will actually make grief worse and start negative ruminating loops that keep the stress circuitry going up that drive the depression. So we have to look at that piece of it. That's the psychotherapeutic, psychodynamic piece of it. But we also want to look at the whole lifestyle. What's their sleep patterns? If they don't have healthy, I can't tell you many patients don't have healthy sleep patterns, and that drives depression. What's their diet? Are they eating the typical American diet? The American diet is highly inflammatory and drives toward depression. So I, in my practice, will intervene and do lots of things around the lifestyle. They exercise or not exercise. Sedentary lifestyle increases inflammation, drives toward depression.
So exercise is a big factor in
Exercise is
depression.
antidepressant.
Okay. Oh, okay. Explain that.
And exercise has antidepressant benefits. When you exercise regularly, your muscles produce interleukin-10, which is a very powerful anti-inflammatory factor that suppresses inflammation in your body. Okay. It also turns on all the neurotrophins, which are factors in your brain that are like fertilizer of your neurons, which causes the brain to be able to sprout and make new connections. It produces dopamine, endorphins, and enkephalins, which are mood elevators, and it picks your mood up. It helps establish better sleep, circadian rhythm, so you get better sleep and better restorative sleep. So exercise across the whole landscape of your physiology has antidepressant benefit, and studies show that people who exercise do get antidepressant response from the exercise. Okay. But I must point out, it's not simply exercise. Your mindset about the exercise matters. So if you're doing an exercise that you don't like, that I've got to do this, but I hate it, it's miserable, you don't get the benefits from that. You have to choose an exercise that's enjoyable to you.
So we don't have to go join a gym and start doing if it's things that we don't want to do.
Well, if you don't enjoy it, you're not going to get the benefit. You will actually, your negative mental attitude about it, it would be your emotional response to it would be more like torture, which means you activate your stress circuitry and you cause the stress cascades rather than
depression.
Yes, exactly. So it works against you.
Right. Wow. Okay. So, how about relationships? How do they impact our risk of depression?
So relationships that are conflictual, relationships that cause stress are going to drive and cause and keep people stuck in depression. Relationship where autonomy and freedom is undermined is going to cause depression. But, so what are the big drug-free treatments for depression? First thing, you want to identify what are the contributing factors. Then you want to look psychodynamically and psychotherapeutically. Are there belief systems? Are there ideas? Are there patterns of thinking? Are there patterns of relating that keep driving person into a stress? And you want to intervene to resolve that. So cognitive therapy, seeing a psychotherapist to help them have healthier patterns of thinking might be a very appropriate intervention. And in fact, the studies show that cognitive therapies have antidepressant benefit. Okay. And the brain studies show that cognitive therapies actually calm the stress circuitry and improve the prefrontal cortex circuitry. So that's a very appropriate therapy. We want to look at the sleep and make sure we maintain stable sleep. That is very important as well. We want to remove from the body anything that is inflammatory in nature. So I mentioned the junk foods and the fast foods, but alcohol and drugs. Alcohol is depressogenic. You're drinking a lot of alcohol, that drives towards depression, interferes with sleep architecture. So you need to kind of remove that from the system. Adding in exercise that we mentioned has benefit. And then nutritionally, omega-3 fatty acids from fish oils are anti-inflammatory. There's required fats for your brain. 70% of the fat of your brain are from omega-3 long-chain DHA EPA fats. Our body really makes very little of these from the food sources we get, from the plant food sources we get. So we need to really get it from either marine algae or fish oil.
Okay.
And people who are low in these types of omega-3 fats have higher rates of depression than people with normal amounts of these. So we do that. We want to make sure we have good B vitamins, the folic acid, B1, B12, thiamine, niacin, and so forth. We want to make sure we have the good B vitamins. Low in B vitamins, higher rates of depression. Treating with, in fact, 60% of people with depression have a gene mutation where they cannot metabolize folic acid from food into the form the brain needs. The brain needs the methylated form of folic acid, and only the methylated form can cross your blood-brain barrier. 6 out of 10 people with depression have a gene mutation where they cannot metabolize folic acid from food into the form the brain needs.
So how do you get it?
You have to take it from a supplement. Okay. And when you take it from the supplement, now the difference between folic acid and antidepressants, the brain needs it in order to make dopamine, norepinephrine, serotonin, your brain neurotransmitters. Okay. Antidepressants do not cause the brain to make neurotransmitters. Antidepressants affect the machinery that transports them. So conceptualize Little Debbie factory makes Little Debbies.
Yes.
Trucks move Little Debbies around.
Yes.
Okay. Antidepressants metaphorically work on the trucks. They work on the transportation system of the neurons, that transport the neurotransmitters. The neurons, the factories, make what goes in the trucks.
Right.
And so L-methylfolate is like your peanut butter and your flour and stuff, what you need to make what goes in the trucks.
Okay.
So if you're low on your L-methylfolate, your factories slow down, you get depressed.
Okay.
You give antidepressants
And
to
all
affect
it's revving up
transportation.
your truck.
It's
got
affecting
nothing.
transportation metaphorically, okay?
Right.
But its effects are not very robust if you don't have enough production coming out of the factories. So L-methylfolate is independently of antidepressants, has an antidepressant benefit.
Okay.
So we replete people with L-methylfolate. It's a non-drug intervention. It's a nutrient intervention that helps people with depression.
Okay.
So there are lots of these types of interventions that we can do that have antidepressant benefit.
Are there any others that you want to mention?
N-acetylcysteine, which is a mitochondrial membrane stabilizer, mitochondria.
So are these like listed on your website? Is there some place that maybe we can go to Tim Jennings, MD, and see a list of this
No.
stuff? It's a lot of information.
No,
Okay.
where they're going to have to get this, I have a book coming out in June called The Aging Brain,
Okay.
Proven Steps to Prevent Dementia and
Okay.
Keep Your Mind.
So all this information is in there. They can go
It's
and
going to be
underline.
absolutely.
And,
Every
okay.
bit of this and more is in the book on the aging brain.
Okay.
Okay.
It's not just for older people. It's for
No, this is
okay.
for brain health, and it's
Okay.
all in there.
Excellent.
Yes.
Okay. Okay. Sorry to interrupt. But-
Yeah.
Okay.
So N-acetylcysteine is a mitochondrial membrane stabilizer. You can buy this over the counter, 500 to 1,500 milligrams. A mitochondria, the little organelles inside your cells that produce energy.
Mm-hmm.
Okay. People with depression have dysfunctional mitochondria. They kick a lot of free radicals. That's oxidizing to the brain. This is also one of the reasons why the same inflammatory cascade that drives depression is one of the reasons why if you have depression, you have increased risk of dementia as you age, because it's the same inflammatory cascades. And so all this stuff that helps keep your brain in a non-depressed state also helps prevent dementia as you age. So it's all really good healthy
Wow.
stuff for your brain.
Okay. It's very okay. So the aging brain.
Yeah, that's a book that'll come out in June.
Okay. Excellent. So what if a person is suffering from depression in the time that we have left? What is your advice?
Well, first, they need to get professional evaluation. See a psychiatrist, get a good evaluation, get a proper diagnosis. Make sure that you don't have some underlying physiological cause, because no antidepressants and all the nutritional stuff that I've said and the good sleep and the exercise will have no benefit if you've got hypothyroidism. You need to have your thyroid treated. Okay? All right. So you need to get a good physical evaluation to make sure there's not some underlying physiological cause that are contributing to the reason that you specifically have depression. And if there's not, then you want to see a psychiatrist, and hopefully a psychiatrist who has a little bit of holistic perspective about how to hit the contributing factors, and not simply somebody who's just going to throw an antidepressant blindly at you.
Right. Okay. So there you go with the reasoning. You got to
Yeah.
exercise your skill. So antidepressants, we're going to talk about that, I think, in another show. We did touch on
Yes.
a little bit this time. Next show, we're going to be talking about codependency, healthy love versus
Love addiction.
love addiction. Okay? That'll be on our next show. And if you have any questions for Dr. Jennings, please go to timjenningsmd.com. There's resources. You can ask a question. And we are just grateful that you're watching, and continue to tune in next time.